I'm in?
You're in.
Okay. Hello, everyone on the webinar. Thank you for joining us. Hello, everyone here. My name is Michelle Capello. I'm a physical therapist. I've been a physical therapist for about 25 years. I play soccer. I still play soccer. I've torn both my ACLs, unfortunately. And I'm very much committed to the ACL Prevention Programs. And as a medical profession, I think our sports medicine, we obviously have not done enough job in terms of getting out there with these prevention programs, because we're just seeing that increased rate out there, especially soccer being one of the key sports. So, the fact that you're here, the fact that you're listening, I know that there's an interest out there, and we're trying to get out and sort of train the trainers. So you guys teach other people about what we can do for prevention, because ACL injuries, sports injuries are going to happen. Sports medicine, we will have patients, but they're preventable. These kind of things, non-contact, are preventable. So how do we make athletes more robust, more injury resistant, especially to this particular ligament injury? Okay.
Powered on?
Power's on. Oh.
There, now we're going.
Good. Okay. So I'm going to make sure we don't go too far over, but in my time here, we're going to go over some of the ACL prevention components of the program. I chose the FIFA-11 program because it is the most easily distributed. It's the if you go online, go to FIFA11.com. It is a soccer-based program, but the exercises are universal. It's for volleyball. It's for football. It's for basketball. It doesn't matter. They're body movement exercises. There's no weight. There's no equipment. There's videos on it. They make it so easy to implement. The key things. So that's what I chose to go over with, and how you do those exercises is going to be the key. And I put in here a better understanding of the role of the soccer coach. Take soccer coach out, put athlete in there, put a physical education teacher, put parent in there as a key person for the implementation process. It can't just be the sports medicine professionals in the clinic, because we need more folks out in the field doing that. And then also, Dr. Panji talked about this a little bit, the guideline of how to identify athletes that are at risk, that might really need to spend a little bit more time on the movement corrections with some of these movement patterns. So the risk factors. There are risk factors. Dr. Panji talked about them a little bit, but what do we have control over? We have control over how we move, that neuromuscular training. So how we move, how we take this knee joint and go up and down, versus, twisting. The knee's not designed to twist. The ACL will prevent that twisting, and if you twist it enough, it's going to pop. Or if you, shove that shin too far forward, it's going to pop. So it's not designed for that. So we can correct some of the movement patterns, specifically how we land, cut, and pivot. And then we talked a little bit about, we do have some control over the turf question, like what kind of shoe are we wearing on what kind of surface. And not having a shoe that's going to stick too much, and that sort of speaks directly to that. So being aware of what shoe you're wearing, and is it appropriate for that surface. So it's a really hard field, even though it's grass, you might want to go with a different type of shoe. So these are the things that we're going to focus on what we have control over. Here's the what we call biomechanical, which is really the mechanics of how we move. It's a faulty plant and cut maneuver. So they did do a 2A soccer player, and they actually videotaped them. This is back when we used to videotape. And they counted how many times they cut and pivot. And it was 1,500 times in a game. So it's 1,500, as Dr. Banker said, crossing the streets, 1,500 times you're going to land on that leg and come off. I'm sorry, so maybe 750 per leg. And you can just sort of think about that same thing in a basketball game. How often are you cutting and pivoting? And each time you load that leg, you're loading the ACL. We're designed to take that, but we're designed to take it in good mechanics, not in that faulty mechanic pattern. This is a classic example of a faulty pattern. They call this the medial collapse, medial moving towards the inside of your body. So if you're moving like this, you have to fix how you're moving, or else it's going to, after 1,500 times, get strained and eventually tear. Medial collapse, the hip internally rotates, so that means the thigh kind of comes in, the knee will then buckle in, and the foot and the arch flatten really rapidly, so you get that flat foot. I should stop with this side and do it on this side. So that's one of the main things. And here you can see this athlete here is landing with pretty much a straight limb. It's loading straight up and down, versus the other athletes getting that medial collapse, really lack of hip control. Not only, I wish I had a side view here as well. It's not just not letting the hip in. What's even probably a little bit more critical is the minute you land, are you letting your hip bend and using the hamstrings and the glutes? I think if you don't use those hamstrings and glutes to bend at the hip, then the knee's got to go somewhere and it's going in. So it's not just don't let the knee in. It's like make sure you're using the glutes, which is the glutes and the hamstrings. So you've got to bend backwards like that. Okay. Biomechanical risk factors. So here's things that we do as screening tools for looking at athletes that might be at risk. So I coach and I'm looking at the athletes as they're doing their warm-ups and who needs a little bit extra attention, who needs a cue. And if you see these things, and I'll go over them, and they're unable to be corrected, then they might need to go in to see someone for one-on-one, or they need to do a little bit of extra homework on their side to correct these patterns. But faulty landing on one limb. So whether it's one leg or two legs, you know, are they letting their knees collapse in? So 8 and 9-year-olds, I say don't kiss, knees don't kiss. No kissing knees when you're jumping. Shallow knees. For some reason, female athletes, when I say shallow, I mean they're not bending their knees enough. They're not getting their hips back and the knees to come down. So the knee's not bending enough, they're not letting that hip back down, and it's probably going in. So the lower they land, the more knee flexion, the more hip flexion, the less likely you're going to get injured. Landing on the outside of your foot. So if you see people sprinting and they land on the outside of their foot, what's going to happen is at one point that foot needs to come down, so it's going to rapidly want to go in like this. So we look at, usually I'll see this more with running and sprinting, if they're landing on the outside of the foot and then they slam in. There's some running technique we have to work on there. Flat foot. So this picture has a good example of that. Flat foot during the end of kicking or changing of direction. So if I'm going to kick or change and my foot is completely flat, so this would be like my foot's stuck in the ground and I'm rotating, it's going to rotate through, if the foot's stuck, it's going to rotate through probably the knee, if not maybe then the hip and the back, but most likely it has to go through the knee. So you can just see in this picture, there's a lot of rotation through there. So flat foot, especially with kicking and changing direction. You want to be like instead of a bowling ball, like stuck to the ground when you drop it, you want to be like a tennis ball, just spring right up. You want to see that heel come up, especially at the end of the kick. We're changing the direction, heel come up off the ground quickly. Heel in front of the hip or outside of the center of gravity. What does that mean? So if I change direction and my heel lands first and it's outside my center, all right, that really loads, my knees sometimes got nowhere to go but here. So we teach people small steps and change direction with your body over that limb instead of the heel outside. All right, small steps here, body weight over that limb. So you got to keep your center of gravity over that leg. And then the upper body, I'll show you some pictures of this, upper body shifting outside your footprint. So if I do land here, but I keep going, then that also pushes the knee. It's got nowhere else to go but in. So a lot of this, you know, can be corrected with strengthening, but we can't just strengthen muscles. We have to make them smarter, and this is how you make them smarter, by correcting these things. So this is I'm gonna keep this on the this will be on the website to just kind of do a check off with your athletes if needed. All right, coaching good skills, good habits. So we do a lot of the movement re-education here, and that's very clinical, but it needs to be reinforced at every practice. So it has to have good practice makes good habits make good biomechanics. So we need help to get these good movement patterns consistent. So every time you stand and you pass, you know, you have that good position. Every time you're running and cutting, practicing cones, practicing jumping and landing with volleyball, it's, you know, we have the coach, the parent, other athletes looking at each other like, whoa, your knees just, you know, totally caved in there. So we need that happening out of the clinic and in the field consistently. All right. Dr. Pandry talked about some of these various programs that have been well researched with good injury prevention reduction rates. And Santa Monica is actually involved in establishing some of the FIFA, or consulted for the FIFA 11 program, Sports Metrics with Cincinnati Sports Medicine. And they have a great program which incorporates a lot of strength and jumping. All right, so now what we can do. So like I said, I chose the FIFA 11. It has all the components of it. I'm not necessarily only doing the FIFA 11, but like I said, this is the most implementable in my opinion, and it's got the components of it. I do adapt it a little bit for the younger ages. I won't go as long, and I'll show you some of the things that I'll do maybe a little less of in terms of timing. But like I said, it has all the fundamentals. It's 3 parts. It's a warm-up. It's designed to be a warm-up before every practice. All right, it's got 3 parts, 15 exercises. I'm going to go over a few of them. Key points are the proper use, proper technique, proper posture. You know, we sit all day on our bottoms, on our hamstrings, and we collapse here. And these are the, you know, we need core and glutes and hamstrings for the prevention program. So we sit all day. We have to reinforce the good mechanics when we're doing the exercises. It includes the straight leg alignment, which means that you want that leg straight versus caved in. Knee over the toe versus the knee inside of the foot, and soft landings. Not that rigid knee landing, that nice absorbing the shock landing. It starts off with some running exercises, and then it goes into strengthening exercises. And did you guys all get a handout for it? And then as part of that, balance is in there, and then plyometrics and agilities. And then we end with the running exercises, which we're not doing here. But this, you're going to go slow, sort of medium effort, and then here you're almost at full speed with the training. ACL injuries happen at usually that full speed motion. They don't happen when you're doing these nice, slow, controlled motions. So you have to train, you know, when similar to the sport, so that we add in that higher effort there. This is an example. I know you're not supposed to be able to read this, but this is what it is. If you look it up on the website, you can download it. You can send it to your phone. If you have videos, you can send it to your phone. They have these little things you can order online to keep in your coaching bag or keep anywhere you need. So they'll send this to you. You guys can look at that if you want. All right. So it's, like I said, the 3 parts: the running exercises, the strength and plyometrics, and then finishing up with the running exercises. Before games, it's just sort of the running and form, and then they leave out, if you're going to have a competition, they leave out the strength training for that day. It takes about 20 minutes. Athletes can do this maybe even prior to the coach getting to the field, and they can do it or individually if they need extra work. This is a slide that just says the folks that replaced their warm-ups, their regular warm-ups with the FIFA 11 warm-ups. This is all injuries. So they had 37% less injuries in their training programs and 29% less injuries in their competition, which is huge, The key is that they were consistently doing it. All right, part 1, running exercises. So retraining running is a common denominator with many sports. And I can tell you that a majority of our athletes coming in do need some correction, as we all do, with how we run, how we load. Anytime you're running, you're landing one leg and then the other leg. It's a single leg landing activity. That single leg landing activity is an ACL, is where your ACL does have to take some loads. We need to do that well. So running, straight ahead running. So just having someone balance on one leg, just that alone will predict it. So we want to make sure that you're not going to get a trunk going side to side. You don't want stiff knee running, you know, up nice and high. You want them a little bit bending, a little bit soft at the knee. So looking at how they're just jogging across the field. Keeping tall, nice soft knees. This is a particular soccer exercise, but it goes into, you know, when you are lifting your leg, do also teeter-totter with the trunk. So it's an easy thing. But this could be replaced with skipping, so you're not getting a teeter-totter at your trunk. Circling your partner, that's a side-to-side shuffle. All right, and this is shoulder contact. Yeah. So let me have you come on up for shoulder contact. So I do this with the 9-year-olds, and it's really important that that you learn how to take a little bit of contact, because if you're ever put off balance and you have to land on your leg, that you're ready for that. So shoulder contact is, we'll kind of, you're over there, all right, and then we'll just jog like maybe 6 meters forward, jog to about there.
Actually, I'm.
Oh, you're not, walk slowly. You're not going to jump. You're not going to jump. All right, and then we side shuffle together, and now come to me.
Oh.
And then here, don't do it if
Yeah.
I hurt you. Okay. We would jump up, hit shoulders, and then land back down again. So we take contact and come back down. You want to try it with me? Can you jump?
She's 3 months out.
Oh, you are?
Yeah.
Oh my goodness. Okay. Okay. So just take a few steps forward, and then right here I have them jump up and then to shoulder, and then land. All right. That little bit of contact, it doesn't have to be hard, but that teaches them to like, whoa, it gives them a reaction. All right. So I love this one. I love this one. This is an important one, but they have to land with that good mechanics. You guys know it all now. No medial collapse, but back. Get the hamstring and core. If you keep your trunk tall, you're using core. This is the best core you can do. All right, strength. The plank. The plank gives you a nice, rigid core. Everyone knows the plank. Here's what's critical about this picture is the forearms are parallel. All right? No planks with the hands like together like this. That teaches you, to come in like this. If you do your plank with your forearms parallel, it brings in your back muscles more, which is what you want. If you do it like this, you get that rounded back position, and that's what you're going to train in. So, plank with your forearms parallel, your back obviously straight. No sag either way, but the forearms are the key piece here. Going to single leg with the plank. Take your time with this. This is up to 30 seconds. Done twice. Sometimes maybe the kids, I'll do like 10 seconds if they can even get to this point with lifting one leg up. You'd be surprised at what you see what happens with one leg. These are injuries that happen with one leg on the ground, so you have to train one leg on the ground. Nothing should move except the limb. So I don't know if you're going to be able to see me, but if you're doing this, your plank here should look exactly like the 1-inch leg lift on each side. And you'll be able to see if one side is asymmetrical versus the other. So the leg lift's key. Side plank. Getting that side core so you don't get that tip, right? The side core with the side glute. Nice exercise starting with the knee bent on the bottom, so it's not too much strain on that front shoulder. This, look, head down. No, you want that head core up here, or else you're going to train down like that. So the core is everything, head all the way down to your hips. This is a progression with this. This is a really hard exercise to do well. If they cannot stay in that same plane of movement, they should not be doing this, because then they're going to train off. So side plank with the leg lift, very hard to do, but good point to get to. So they call it, in FIFA, they call it the sideways bench with the leg lift. All right, the hamstring curl. This is, the Russian hamstrings. Have you done this one before?
Yeah.
Have you? Yeah. Do you have a sweatshirt? I forgot to bring up a sweatshirt, or just something for his knees. Maybe. Oh yeah, grab a sweatshirt. Yeah. So the hamstrings are critical because we are we tend to be very dominant female athletes more than male athletes. But you saw RG3, very.
Back a little, we'll get you on camera.
Oh yeah. Okay. So face this way. Face this way. In the beginning, this is maybe 3 repetitions done twice. That's it. It's so we have them. One of your partners will hold the leg here. And then what you want to do, you've done it before? Okay. He wants to keep his core completely straight. So you have to have a tight gut, tight butt. All right? And then you just lower down keeping your knees on the ground and lower down as far as you can keep that. The minute you break it, you just drop to the ground. Okay? So let's try just one. I'm going to hold his legs. He's got a tight butt and tight gut. Go ahead down. And then once he starts to break, nice. That was really, he made that look super easy. That's great. All right, you want to go one more? Okay. So go ahead down. Good, good. Great. 2 or 3 to start with, done twice. And then you can progress it up to, these are about 1 minute per drill for the older ages. So those are hard. If that's too hard or they cramp up too much, we'll do, we'll put their feet on the ball and do a bridging exercise to also get the hamstrings. Because we need these hamstrings and these glutes to fire. We need these. This is a critical piece. Where's my next volunteer? Yes. So if that exercise is too hard, and often it is, you're going to lie down on the ground. Bottom here, head there. Yeah, face up. You're going to be here. Yeah. Lie down on the ground, on your back. Oh, yeah. Okay. And let me have your body shift a little bit towards me. Perfect. Perfect. Good. Oh, okay. So go ahead and bend up. This is a critical one. Go ahead and bend your knees all the way up. Bend them up. Bend them up. All right. Now here, what you want to do is keep that ball in the same location and just lift up your buns using your hips. Go ahead and lift your hips towards the ceiling and back down. Shin in. All right, this is good. A couple more. Do you feel the back of the legs? Yeah. Yeah. Okay. Good. We go double leg and we'll go single leg. A nice hamstring glute exercise. Okay, go ahead up again. Balance. I cannot emphasize the single leg stance enough. All of this has to start with, can you just balance on one foot? Brush your teeth, standing on one leg. That's it. You know, like just start, because if you don't have this, you're not going to get this, and you're not going to get this. Start with that. There's research articles about there, especially with this trunk sway. Like if you're doing this, you know, we're never going to get you to cut and pivot well. So balance. Single leg balance, ball toss, single leg balance, brushing teeth. And here we're doing some contact with that. Squats with the toe raise. So this is you squat down, make sure those hips are going back. See this rounded position? This is us sitting all day. Let's see. Walking lunges, also good for core. This is how we use our core here. This is why we do core. To keep our body from doing that, a lot of that trunk sway back and forth. You can watch for medial collapse here as well. So I have them sometimes do it on the line, you know, to keep the line in between the legs. And nothing crosses midline. The hands, right? The back foot, nothing crosses that middle line. That's a good cue for them to self-correct. Vertical jumps, and now we're bringing in a little bit more. So we're taking all this fundamental movements and we're adding some plyometric to it. Let's see, now we're getting into the running exercise at a little bit faster pace. Bounding is a hard exercise, and I usually start kids with just skipping. So looking at the line, making sure nothing crosses. Their foot doesn't land, their heel doesn't land first. Keep them on the line, left foot stays on the right side. Left foot stays on the left, right on the right. And then we just work on that. Everything stays straight. No heels out in front. So skipping is what I'll sometimes replace the bounding with. And the cutting and planting. That's a really critical motion, right? That's it. If you can get that position down right, good hip, knees not rolling in, that'll work. So we talked to a lot of reasons why this works. It works on the strength piece of it. It works on technique. You get your core and balance built in there. And then they did studies why this doesn't work, why some teams did the FIFA 11 and it didn't work. And what happened is they didn't do it for twice a week for 10 to 12 weeks. That's actually how long it needed to be. It was like once a week and they tailed off at about 8 weeks. So it needs to be constantly implemented. When people take breaks from their season, they need to restart some of this before they head back in. Poor technique, you can do this, but with poor execution, it won't do you any good. It's actually worse. And this is a small component of the athlete's profile. This is one piece. This is a warm-up, nutrition, sleep, fatigue. Fatigue is the #1 reason why kids get hurt, overuse. So just keep in mind, it's one piece of a big profile. So I want to put it a little bit in perspective. Exercises alone are not going to do it. It's a whole profile. All right. Thank you. Sorry I went over a little bit over. Do you guys have questions? I'm happy to. Yeah.
So with the progression of level 1, 2, and 3, what's the time span that you would say in between each progression if they're actually doing it 2 to 3 times a week for 10 to 12 weeks? Is that how you would progress through the levels?
So I would only do. Let me make sure I understand your question. Like, how do I progress them within one day, or?
No. So let's say, right, we have level 1 here. Mm-hmm. When would you then go to level 2?
Oh,
after how many weeks?
I've done let's say I've done 4 to 6 weeks.
Okay.
And sometimes, yes.
Okay.
It depends on the age group. A little, if they're older, they might progress really quickly. What's hard is that I'll get different level athletes, but I'll just kind of scale it down to, I want everyone doing the same thing, but you're working on your corrected exercise a little bit different. But it can take 4 to 6 weeks. I just need them. I mean, that first level is so important. It's so important. So you can take 2.
Any other questions online? All right. Thank you, everybody, for coming.
Thank you.
And if you have any questions, you can always follow up with me at sportsmedicine@mail.cho.org. Thank you.